acute abdomen. What are the causes? Like causes of acute abdomen, we can divide it into intra-abdominal causes and extra-abdominal causes. Under intra-abdominal causes, we can use the mnemonic of alphabets A to I to remember all the causes. So first from A. From A, we can remember appendicitis. Intra-abdominal cause, appendicitis. Then there are other causes like acute mesenteric lymphadenitis. Acute mesenteric lymphadenitis. Then any aneurysm, which is basically dissecting aneurysm. If there is dissection of the aneurysm, it can cause severe pain, usually back pain, and can also present like acute abdomen. Next, B. B for basically burst. You have to remember B for burst, and by the word burst we mean perforation. If there is any hollow viscous perforation, which you can easily identify in a erect abdomen X-ray, you will see gash under diaphragm sign. This most common cause for this hollow viscous perforation is peptic ulcer. You can remember burst can occur due to appendicitis also. It can cause burst appendix, which can also present as acute abdomen. Next comes C. C for colic. Colic might be of different origins. It may be a biliary colic due to a gallbladder stone or biliary tree stone. It may be due to a ureteric colic, which is very painful, by the way. It can be due to a sigmoid volvulus. And again, in case of, if you look at it as a gynae cause, it can be a torsion of ovarian cyst. So torsion of ovarian cyst can also present as acute abdomen. Next comes D. D for dysentery. Most of the dysenteries are due to amoeba species, maybe due to entamoeba histolytica. That is more common species, which can cause amoebic dysentery, or maybe due to Shigella species, which can also cause dysentery. Next comes E. E for enterocolitis. Then F. F for factitious causes. Someone might act as they are having acute abdomen. It has to be evaluated properly to exclude the factitious cause first. Then G for growths. Some growths might be present in cecum or maybe in the right colon, which can cause pain abdomen, present as acute abdomen. Then from H comes hemorrhage. Hemorrhage can be pretty dangerous. It can lead to hemorrhagic shock. So we should always keep in mind to exclude hemorrhage first. If there is any history of road traffic accident or any blunt trauma to abdomen, you should always think of splenic rupture. Splenic rupture can cause hemorrhage and present as acute abdomen. Next, if there is history of amenorrhea in a female patient which presents as acute abdomen, you should exclude ectopic pregnancy. You should exclude ruptured ectopic pregnancy. This ruptured ectopic can cause hemorrhage and can lead to hemorrhagic shock pretty fast. Next comes I. I for, there might be two causes. One may be inflammatory causes like acute cholecystitis. Itis means inflammation. So acute cholecystitis means acute inflammation of the gallbladder. Then acute pancreatitis, even acute appendicitis. From I, we can get another cause also, that is ischemic causes, where blood supply to the GIT or specific organs are compromised. What are the ischemic causes? It can be acute mesenteric ischemia. So these are the intra-abdominal causes of acute abdomen. Now let's see about the extra-abdominal causes. All the extra-abdominal causes of acute abdomen starts from C. There are basically four causes. C for chest-related causes like acute pulmonary infection or acute pleural infection. Any pulmonary or pleural involvement can mimic acute abdomen. Next comes central nervous system. Central nervous system causes are herpes zoster. Due to herpes zoster, there might be lower thoracic involvement. This lower thoracic involvement of herpes zoster might present as acute abdomen. Next comes crisis. C for crisis. What kind of crisis can cause acute abdomen? Like hemolytic crisis, then porphyria, tabetic crisis. These things can cause acute abdomen. Then you have to pronounce C like K here. Okay, we are replacing C with K for the fourth cause. Here it is ketoacidosis. That is again diabetic ketoacidosis, which is a metabolic cause. Now, last, we must remember something. C for children. In children, we must remember presenting acute abdomen case might be due to infection of urinary tract. We have to look for UTI. We have to exclude another thing in children, that is intussusception. Intussusception we should exclude in children. And in case of children, in intussusception, we will find a red current jelly stool that is found in intussusception. So that is all of extra-abdominal causes of acute abdomen. So we have discussed so far all the causes of acute abdomen. So how do we divide them? How do we classify them? You have to remember there are intra-abdominal causes, there are extra-abdominal causes. Now intra-abdominal causes may be due to any kind of inflammation, any kind of ischemia. It can be due to any burst appendix, maybe it can be due to perforation. And most important things that you must remember to exclude first is hemorrhage. If the patient is in shock, and you should exclude the hemorrhage, you should exclude any blunt trauma to abdomen leading to splenic rupture, or you should exclude in females, you should exclude the ruptured ectopic. So these are the most important things that you should remember about these causes. And mostly you should do investigation, which is not an emergency, but you should keep in mind that if there is any growth in the bowel, you should evaluate that further. And any colicky pain, you should in female patients, you should look for torsion of cyst, torsion of ovarian cyst, you should exclude. That is also dangerous. The intra-abdominal causes. Extra-abdominal causes, you can look for ketoacidosis and any crisis that you should, they are very important to look for first. You should look for hemolytic crisis and all. In children, we have already discussed. So thank you for watching.